considering TRT in Australia. But what is the real out-of-pocket cost? Prepare for a shock. Your first year can cost from $1,000 to over $4,000. And if you think your private health insurance will save you, think again. For most outpatient services, like TRT consults and medication, you are entirely on your own. We'll break down every cost, show the one thing that slashes prices, and compare pathways for the smartest choice. So, where does a number like $4,000 actually come from? It's a series of costs that add up over the year. First, initial consultations. A GP is $50 to $150. A specialist can be up to $350 for the first visit. Next, the diagnostic blood tests. Without Medicare, this initial screen can cost you between $80 and $200. Then, ongoing maintenance. Follow-up consults and regular blood tests every 3 to 6 months. That's hundreds more each year. And the medication itself. The type you choose dramatically affects the price. Injectables are most cost-effective at $40 to $100 per month. Prefer daily gels or creams. Be ready to pay more, often between $80 to $120 per month as a private patient. This sounds expensive, but isn't there a government subsidy, the PBS, to make medication affordable? Yes, the pharmaceutical benefits scheme can be a massive win. It drops a month's supply from over $100 down to just $30. But here is the single most vital fact about TRT costs in Australia. To qualify, your testosterone must be at or below 6 nanomoles per litre on 2 tests. Why does that number matter? Because doctors often treat low T when levels are 8 to 12. You can have a diagnosis and still not qualify for the subsidy. So, can the PBS make it cheap? For the vast majority of men seeking treatment, the answer is no. You will be a private patient. Knowing most men pay privately, you face a major decision: a traditional local doctor or an online TRT clinic. Let's be clear, online TRT clinics are fully legal in Australia with registered doctors. They offer convenience and privacy, but the biggest draw is cost. Telehealth clinics can have annual savings from $1,200 to over $4,000 compared to some specialist routes. However, one step is never skipped, online or not. In-person lab work for your blood tests is mandatory for safe treatment. Sometimes, paying for the most expensive doctor, an endocrinologist, is the cheapest long-term move. Their expertise might get you PBS qualified. Okay, you've chosen a path and budgeted for testosterone. But is that the final bill? Often no. Proper TRT isn't just about testosterone. What about managing side effects or preserving fertility? Want to maintain fertility? You will likely need HCG. This can add another $80 to $200 per month to your total. Need to manage rising estrogen? An aromatase inhibitor might be prescribed. That's another $20 to $60 per month. Using injectables? Don't forget supplies. Syringes, needles, and sharps containers can add another $200 per year. So, the cost of testosterone alone is misleading. The true cost of your entire protocol can be significantly higher. Let's combine this into a clear strategy. Recall the strict PBS threshold of 6 nanomoles per litre and the expensive specialist option. Your finances depend on these two. If your first blood test is very low, say a 7, paying for a top endocrinologist is a smart gamble. Their expertise might get you subsidized. But if your level is higher, a 9 or 10, you have almost zero chance of PBS eligibility. A specialist is a waste. An online clinic is most cost-effective. Here is the key takeaway. Your initial blood test result is not just a health metric. It is the most critical piece of financial information you have. TRT is a medical treatment, not a lifestyle supplement. Australian doctors require a legitimate diagnosis based on symptoms and blood work, and ensure your protocol is optimized. A single injection every 2 weeks often creates a hormone roller coaster. Frequent, stable dosing is better. The cost of TRT in Australia is a maze, but you now have the map. Understand the PBS barrier, weigh clinic costs, and factor in the hidden expenses. Don't start this unprepared. Get your initial blood work done first. Use that number to choose your path wisely and save thousands.